Good morning, colleagues. Warm welcome to you all from warm Bangkok. Many thanks for joining this session E2, birth registration and certification. Uh, there are 5 excellent papers to be presented, and I'm sure there will be lively discussion. So in the interest of time, I'd like to start our session. There may be other colleagues joining in soon, and a warm welcome to also colleagues who are following us online. We're watching out for your comments, questions. If you want to make, please add your questions and comments in the chat box of the Teams session. Hope that you can hear us currently virtually. But if you have any connection problem, please do let us know. Okay, so this session is looking into birth registration, completion, certification, timeliness, and inequalities in birth registration relating to SDG 6.9.1. Regionally, we have excellent representation. We are going to go through Africa. We have also country-specific papers with the focus on Tanzania and Zimbabwe, in addition to a broader regional paper. And then we have great papers from Indonesia using very rich data, household survey data. So we'll look through that, and we look also forward to comments and maybe other experiences from the floor from other countries participating. Let me first, it's going to be, I think, a bit of a marathon as we go through the 5 different papers. So in the interest of time, I would like to introduce our speakers, our presenters first, in the order that they will present. And then once we get into the substantive presentations, each presenter will have 10 minutes to present their paper, followed by a 5-minute Q&A, clarifications perhaps, or burning questions. At the end of all the presentations, we'll still have some time to discuss. And if you have further questions, you can also pose them at the end of the session. So with that, I'd like to, sorry. I'd like to introduce our distinguished presenters. So first we have Dr. Mozidi Nilapo, who is the Chief Director for Health and Vital Statistics in Statistics South Africa, with more than 10 years of specialized experience in the analysis and management of data from civil registration system, administrative records, and censuses. She holds a PhD in population studies from the University of Western Cape, where her doctoral research focused on evaluating the quality of the South African birth registration data using hospital birth records. In her current role, Dr. Nilapo oversees the end-to-end processing, editing, analysis, and publication of South Africa's official statistics on births, marriages, divorces, deaths, and causes of death from civil registration. She also directs the editing, analysis, and publication of movement control system data for tourism statistics and leads the production of key health indicators derived from survey and administrative data. Her work involves extensive collaboration with the government departments, academic institutions, development partners, and other stakeholders engaged in health statistics and vital events. At the continental level, in Africa, she provides expert support to the United Nations Economic Commission for Africa, ECA, as a senior CRVS specialist. Her contributions include supporting the implementation of the Africa program on accelerated improvement of civil registration and vital statistics, and mentoring emerging CRVS professionals through the CRVS mentorship program. I welcome you, Dr. Nilapo, and it's very nice to see you here. I know her also from a training we did in Addis. It's very nice to see so many familiar faces, from Africa and from across Asia. Next, after Dr. Nilapo's paper presentation, we'll go her regional paper on Africa. We'll move to Indonesia. Ms. Vinida Alberta from the Statistics Indonesia BPS. She'll be presenting her paper. Ms. Alberta is a statistician with more than 20 years of experience at BPS Statistics. She currently leads the Statistical Data System Working Group, supervising 3 teams focused on advancing official statistics by integrating and utilizing administrative data, particularly in the areas of migration and civil registration. Through the first cohort of the CRVS Applied Research Training Initiative, Ms. Alberta researched Indonesia's progress in birth certificate ownership among children from 2015 to 2023. A key aspect of her research involved analyzing factors that influence birth certificate ownership among children under 5, including regional disparities in registration completeness across Indonesia. By identifying these factors and regional differences, her research contributes to national efforts to strengthen civil registration system, ensuring all children have access to legal identity in alignment with global and regional commitments. I welcome Ms. Alberta also. Many thanks for joining us today. On the third presenter is Ms. Fausta Nidigiti from the National Bureau of Statistics, Tanzania. She's a demographer working at the National Bureau of Statistics, holding a master's degree in demography from the University of Dar es Salaam. With over 12 years of experience in population and social statistics, she contributed significantly to the 2022 population and housing census and Tanzania's annual vital statistics reports. She'll present her paper titled Unequal Beginnings, Determinants of Birth Registration in Tanzania, which examines demographic, socioeconomic, and geographic factors influencing birth registration among children under 5 years in Tanzania. From Tanzania, we'll move to Indonesia back again as the fourth presenter, Ms. Estiana Yesie Prastivi from BPS Statistics Indonesia, who will present her paper. She's a statistician at BPS Statistics with over 8 years of experience. As a member of the Indonesia CRVS team, she has contributed to the country's first vital statistics report based on civil registration, conducted inequality assessments, and focuses on strengthening CRVS systems, improving data quality, and supporting evidence-based population policies. I welcome Ms. Estiana also to this session. And last but not least, we'll go to Zimbabwe, where Mr. Munhuhashati Rajus Sango, I'm sorry, sorry, butchered your name. He'll be presenting his paper entitled Counting Every Child, Unraveling Birth Registration Inequalities for Under 5s in Zimbabwe. Mr. Sango is a researcher with a strong interest in civil registration and vital statistics systems, focusing on inequalities in birth and death registration. His work examines the socio-demographic and structural determinants of incomplete registration using nationally representative data from Zimbabwe. He's particularly interested in how strengthening CRVS systems can improve population data, policy planning, and social inclusion. You're very welcome, sir. Thank you very much for joining us. With that, I would like to move into our first presenter. Let's have a regional perspective from Africa with over 20 countries, the analysis of birth registration in Africa. So I'd like to invite Dr. Mosidi Nalapo to present her paper. I can give you the clicker, which you can, if you like, use in moving the slides. Does that work? Yeah.
Good morning. Good morning. Thank you very much, Dr. Salsa. Morning, everybody. The paper is titled Inequality in Birth Registration in African Countries. I think as an acknowledgement to the contribution towards the work, the research was undertaken under the auspices of API CRVS at UNICA, and we appreciate the guidance from Dr. William, and I also want to acknowledge my fellow co-authors, Jean-Marie, Jean-Claude, and Miss Ziba. I think let me also acknowledge the support we received from ESCAP and especially Dr. Sesha. It's wonderful for you to see you again. I think as an introduction, we know that in sub-Saharan Africa, did I move? Okay, yeah, no. I knew this was not a good idea. Sub-Saharan Africa accounts for 50% of the 80% of unregistered births in Southern Asia and Sub-Saharan Africa. And we know that both the supply and demand sides aspects are contributing towards what we see in terms of the delay in registrations or non-registration of births in the continent. Factors influencing birth registration rates in Africa for groups of children under 5 likely to be left behind were considered in the study. We focus on the outcome linked to SDG 16, as Dr. Sesha was saying, to check the number and the proportion that are registered. Okay. Okay. We use both the data drawn from the DHS and MIX, but particularly the post 2015 when the birth registration was included in both surveys, and we found that not in all countries this was the case. Not all countries had conducted the surveys, but also in some countries they didn't have the question. So we ended up with 37 countries in a continent. The study focused on questions on birth registration, socio-demographic and geographical characteristics of children and their households. We included both household and individual level variables. For the household, it was the wealth status and the residence. And for the individual, it was education level of the mother, the age and sex of the child. We also included in cases where that question was included, which was in mix, we included the questions on language and also on ethnic group. But we found that it was mostly in mix and not in the DHS. Okay. And the CAT model was developed for each country. I'll show you an example. The model split the data and fit the sample predictive models for each segment. We'll show you an example based on Lesotho, where you, oh, dear Lord. Yeah, okay, thank you. Yeah. So so the way the model presents itself is we look at the furthest and the furthest behind and the furthest ahead. In the slide, what you see is that the furthest ahead are represented in blue, and the furthest behind children are represented in I don't know if it's orange. And then the size of the node represent the proportion, the size of the group that is represented. So in the Lesotho example, you see that the birth registration was 80%, and that the biggest identifier among the two groups was the wealth status of the household. So the 60%, 84% of those in the wealthiest 60% were registered. And further, when you look at it, is that for children under 2, only 86% was registered. That is the interpretation of the model. When you look at the results, we found that for most cases, the major factors that define the children left behind was the wealth status of the household, which was a factor in 27 countries. And mostly children under 1 was appearing for 17 countries, where the large proportion was unregistered. Rural residence was also a third defining factor for most left behind children. And when you look at the table, sex of the child was only in 3 countries. And then for age of the mother, it was in 4 countries. So I think the 3 top ones were the wealth status of the household and the age of the child at registration and the residence, the household residence, whether it was urban or rural. Okay. Now, part of what we looked at was within countries. When we compared across and within countries, we look within a country and across the countries. And when you look at this, you look at countries to the far right of the slide, and those are the countries where most of the children were not registered. So this represented like the 17 countries where less than 40% of the children under 5, who only 40% had their birth registered, and their average was 33.4%. And we saw that for countries with lower birth registration rates had larger differences with the furthest and the furthest ahead and the furthest behind. And for countries where the average was closer to the furthest ahead, you found that the situation of the left behind children was dire than countries where you had the average being closer to those that are furthest left behind. Countries like Ethiopia, Zambia, Angola, Mozambique, and Uganda had less than 40% of their children registered. And you also had countries that were almost at universal registration, which was Algeria, Tunisia, Congo, and Cote d'Ivoire. And the difference between the furthest behind and those furthest ahead was about 50% in Central African Republic, Nigeria, Zimbabwe, and Mauritania. Okay. As we indicated, children living in households in the household in the bottom 40% of the wealth distribution were shown to be at the most disadvantage in 26 of the 37 countries. Children under 2 years are the second group that were most likely to be left behind. 11 of the 37 countries had their birth registration below 50%, and this included Angola, Chad, Ethiopia, and Zambia, with rates below 30%. I think I need to hasten and say, because this surveys happened earlier, we expect probably by now some traction will have been gained by some countries in terms of the registration. And we do indicate in the paper that because of the point of the survey, where the survey was undertaken, it's likely that for some countries changes would have occurred, but also you had countries that had more than 2 surveys, so you could at least compare. But you had countries where there was no subsequent survey; it was much earlier, so it was very difficult to have a comparison or to have an updated figures. Okay, I'll just move to recommendation. We recommended that to implement child-focused policies and strategies to address some of the findings, targeted strategies aimed at the poor household or rural household, which include decentralization of CR services, partnership with existing stakeholders in rural areas like education and health. We also recommend the implementation of an active registration system. We know that in most countries, our registration systems are passive. They wait for us to present to the CR offices. We also recommend the introduction of financial and non-financial incentive to promote early registration. Thank you.
Thank you. Thank you very much for your presentation, Dr. Nalo. This is great work that's been shown with so many countries done and showing at times the similarities in certain countries and differences. And your paper moves beyond the national averages of birth registration completeness, identifying the ones furthest behind and capturing the intersectionalities. It's not just one circumstance that leaves children behind, but it's an intersection of a couple of circumstances. I'm fully biased because this is the methodology that we use at SCAP also. So I'm not going to get into methodology or raise any questions. And I don't want to raise any questions before we hear from the floor, from the room. If there are any questions to the first presentation, on the first presentation from the room or online, we have about 5 minutes for clarification questions or anything that you would like to discuss. Maybe while colleagues are waiting, I can fire one. I don't see anyone raising a question. Uh, I don't have difficult questions because we worked on this paper. I mean, we supported you in this paper. But maybe as extensions to this work, in our work, we've also seen this. There are two things that come to my mind, and this relates to your presentation final slide. Uh, One is that at times DHS and mix can be, because they're survey-based data, they can be a bit limited. I wonder if you guys have any plans moving forward to use census data or some administrative data that is much larger and they can go into much smaller administrative units to identify where those children are living within districts or neighborhoods even, you know, to think about it. So if there are any plans using alternative data sets with the same methodology. And then I also wonder if there is any natural experiments in Africa that happened in relation to the financial incentives you mentioned. I'm asking this because the way we entered in the birth registration, I, by the way, realized I didn't even uh, introduce myself. I'm Sasha Pashalı, your moderator, coming too late. Sorry, I was very worried about how we'll go through this, 5 presentations. But I'm a social affairs officer at SCAP's Social Development Division, leading the work stream on leaving no one behind. We have this machine learning algorithm, which has been applied in this paper also, and we have a platform where you can look at SDG indicators, disaggregate them, and identify furthest behind groups in 19 SDG indicators across 33, soon to be 34 countries in Asia and the Pacific. So the way we, on our side, got into this was also through birth registration in Fiji, where there was a experiment that they introduced financial incentives for parents to register their children. So they would, I think the households would receive 500 Fijian dollars upon the birth of the child, and then the other 500 upon the maybe 6th year when they were entering primary school. And in our research, we found that this boosted the birth registration completeness. And it was a bit of a natural experiment because it only applied to certain children who were born after, I think, August 2018, something like this. So I wonder if there are any such examples in Africa, which could be case studies to further analyze. Thank you.
Okay, thank you, Dr. Asosha. Yes, I think to the first question, we will be looking at the CRVS questions in the censuses. What we saw, we in another program that we had at UNICA, is that question as the way the questions were asked in countries were not consistent. So some questions, some countries ask registrations, others notifications. So what we plan to do is to actually do an assessment of how the questions were asked first, and then we'll move from there and see if there's anything we can do with what we have. On the second question, they are country. I know Namibia and South Africa had a good example of that. And in South Africa, when once that was introduced, child support grants, the proportion of children who are registered within the 30 days increased exponentially. And it has sustained registrations, especially from disadvantaged communities. Yeah, there are examples.
Thank you. Thank you very much, Dr. Mosidi. Any questions from the floor?
I know you mentioned you weren't going to ask a methodology question, but I actually haven't heard of the CART method before. Is it that the machine algorithm finds the most predictive factor in of birth registration and then splits it into two groups, and then those two groups have the most predictive factor and so on? And if that's correct, or you can correct me, can you explain why that's, maybe a more favorable way to look at birth registration factors and the type of advantages or potential drawbacks to it?
I think it's good that Dr. Sasha. Yeah. The method is a binary regression tree. It does, yeah. It's binary, so it splits. But I think the good thing it's typically when we do we want to assess birth registration completeness, we'll go to the usual methods we use, the GGBs, but they can only explain so much. I think the good thing about this, it tells you beyond what we know, what we see when we do use these other methods. Yeah.
Thank you. Any other questions? This machine learning algorithm will be used in Indonesia's case in a different presentation. So if there's still questions about the methodology, I can gladly come in, but we have good colleagues here who've experienced it also. So I'll step out. If there are no other questions, then I suggest we go to Indonesia and invite Ms. Alberta to make her presentation. I can move the slides if you like, or you have the clicker and you can. Okay, the floor is yours.
So thank you so much. Before I begin, I want to acknowledge those who made this work possible. This research was conducted through the CRVS Applied Research Training, thanks to UNESCO and UNECA with the support from Bloomberg and Vital Strategies. And my sincere thanks also to my office, BPS Statistics Indonesia, who allowed me to join the course and take the research, provide me with facilities and also resources to conduct this research. And also my college here, we have Yesi and Raja in another room as well. They are a very supportive college. And also to my other colleagues who are not here, Belia Megasari, who also helped me to do the early stage data processing. And also for this part of this study has been presented in International Population Conference in Brisbane last year. And thanks also for the support of IU, HSP, and Vital Strategies. Okay, I will not talk a lot about this since the first presenter has been explained regarding the importance of the birth registration. It is the foundation of a legal identity. It protects rights, and without it, children face higher risk, early marriage and poor health, limited education, and vulnerability to exploitation. Yet, millions of children in Asia-Pacific region remain unregistered. In 2014, as we all know, that Asia-Pacific countries committed to get everyone in the picture. And as a response to that, Indonesia also take action, and there are presidential decree targeting full coverage of birth registration for children under 5 by 2024, in line with the CRVS decade 2014, 2015, 2024. This study explores Indonesia's journey over the past decades, highlighting what has improved, what has remained the same, and what still needs attention. Using 10 years of national data, this is the first decade-long assessment of birth registration in Indonesia. So we use SUSENA's data. It's a national representative data from 2015 to 2024, including almost 1 million children under 5 years old. With dependent variable birth certificate ownership, we run 4 logistic regression models, and we use also the descriptive analysis. So this is the result, descriptive result. We saw progress, so progress is real, but still incomplete by the end of the decade in 2024. But registration increased by 12.5 percentage points over the 10 years, averaging 1.3% annually increase. But in 2024, 15% of the children in Indonesia, or around more than 3 million children, are still unregistered. And we can also see here there is a narrowing gap between urban and rural, which means we see that there is increase in the capacity of people in rural area. And here, this is Indonesia, archipelago country. So we saw that the geographic inequality remains. In Eastern Indonesia, about 30 to 50% of children are still unregistered, while in the Western area, registration is nearly universal. So I'll show you this graph. I hope this not confuse you. So this is the visualization of the odds ratio of the four regression that I run. So this show odds ratio for each variables relative to the reference. To simplify, I only highlight 3 years only for the early years and the middle years and the recent years. Colors indicate significance. Red is not significant. Yellow is significant at 90%. Purple is significant in 95%. And blue significant in 99%. Some gaps from this picture, we saw that gaps are closing, but other still persist. Delay registration, as we saw from the lower part of the graph, it's the age of the children. We saw that the children age over the time, showing that delay registration is becoming prominent from years to years. And in 2015, with an odds ratio of approximately 5-year-old children were 4 times more likely compared to 0 years old. And in 2024, it increased to 8 times. And in the top of the graph, it represent the urban-rural status of the children place of residence. We saw that over the year, the significance, no, it's still here. So the significance becoming red. You know, that it means that urban-rural is not significant anymore. So they more likely the same situation over the years, which means also there is improvement. And also regional inequality, so that urban but regional inequality persists, as you saw from the map earlier. Provinces in Maluku and Papua and Nusa Tenggara are still lag behind Java and Bali area. And we see that this persists over the time, remain lag behind the Java and Bali as a reference category. And also, we see that the household and family really matter to the children of being registered. Household status of as recipient of social assistance, which is identical to the status of poor household, increasingly follow more prosperous household over the time. So if you see in the social assistant age 41, they are becoming more or less the same as with household in a good situation. So, and also we saw that children are far more likely to be registered when their mother is present in the household. Yeah, and when their parents are married, their parents have a marriage certificate, which is also surprisingly children with parents who has marriage certificates are almost 6 times more likely to be registered than those who are not. And health system also matter. Children born from the mother who give birth the last time in the health facilities are more likely to have a birth certificate. And what we also found here regarding the mobile phone and internet access, it changed over the time. In the early decades, it was phone access that helped children to be registered. But over the time, now phone almost insignificant, while internet access become stronger prediction. Means that there are shift in the digital facilities over the time in Indonesia. So what else here? Yeah, we found that the red one in the bottom is the sex. There is no significant differences between boys and girls. So from this result, we find that we are improving in Indonesia, but not fast enough. At the current pace, full coverage could take another decade. So making it difficult to achieve the Asia Pacific extended CRVS decade, and also the goal, SDGs goal in 2030. And delayed birth registration is more pronounced. And the challenge is no longer just coverage, it's timeliness and equity. And barriers are structural, not gender-based. Yeah, and from this research, we would like to give recommendation that we need to shift focus from coverage to timely registration, from general solution to targeted intervention, from system-centered to child-centered approaches, and stronger integration is key, especially between health and civil registration. And we also have room to improve regarding this research, since survey data cannot fully capture comprehensive barriers. Future research that combine quantitative and qualitative approaches in Indonesia will be valuable for a better understanding of registration delays, particularly in underserved population and region. So for closing, I would like to show you this picture. Do you see the picture there, John? No? Really? Oh, yeah, because it's not there. Yeah. UNICEF report that in 2024, 150 million children are invisible, and 3 million are in Indonesia, which is 2 out of 10 children are not in the system yet. So I hope this could drive us to act in whatever capacity we are. So next time we see this frame, we will see these children there because they hold the future of us here. Thank you.
Thank you very much, Vinita, for your excellent presentation and leaving it at a high note in a passionate way. Hopefully, we share the same objectives, goals that every child will be counted. Yeah, because once not counted, they can be invisible. Any questions to Vinita on Indonesia? I see one hand, Petra, in the back.
Thanks, Vinita, and thanks for that great presentation. I think it's really interesting that you're still seeing very strong regional effect, even though you're taking into account many characteristics. Do you know what's driving that? Because like you've taken into account urban, rural, and you've said it doesn't really have much effect. You've taken into account wealth, right, as well. So what do you think is driving this? And do you think that maybe some of the factors that coming through as not being significant could be significant in these very far behind regions. So can we assume that, say, the sex of the baby actually maybe matters in some regions, and we're missing that in the overall picture? Just like from what you know about Indonesia, do you think that this might be possible? What do you think might be driving this very strong regional variation?
I hope I don't misunderstood your question. I think that's a good question because I think my colleague here, she will answer that in her research later on. So this research has been taken like in the national wide. So we will see like from national perspective, which the regional variable there. So that of course it will be interesting to go deep into what affecting those regions will persist over the time. Yeah, more some in some area. Nervous. Thank you. I'm not angry at you. So in some area, even 1 out of 2 children are have this probability not be registered. So in Indonesia, there are we are commonly known that there are different infrastructure facilities in both regions. So which Western region benefit more in infrastructure and development things, while in Eastern area there are still lack of development. And also the education level there are far lower than from Western. So they cannot catch up in many things. So that could affect this lacking, and also geographical situation, because in Eastern area they are more likely archipelago islands and also mountainous area. So like for example in Papua, the population there is only around 2 million for the whole island, while it comprises like one of the most big island in Indonesia. While in Java, we are only 6% of the land, but we have more than almost half of the population there. So yeah, it's also reflecting that the geographical situation there is not easy to catch. In our office, BPS, in order to conduct survey, we need a lot of budget to get the result there because of that also limitation. As Mr.
Thank you. We have one more question, please.
Congrats for the excellent presentation. Can we go to the chart? No, for the one behind. You mentioned the years. I think I mean, this is not a question. I mean, if you look at, this is the COVID time, 2020, 2021. I mean, there is big, I mean, we expect you to have at least the coverage to be low, but you are progressing, I mean, there's a lot of progress that in a positive way that I see, because in COVID, I could remember the chaos we had, so, I mean, there are many positive things that you can get, I mean, when you look at this graph.
So you mean that you assume that during the COVID, the registration will be lower?
Would have been, I mean,
Yeah,
because, there was lockdown,
Yeah,
I mean, there were a lot of people didn't go to hospital, there would have been home deliveries, there would have been, it's a total chaos.
Yeah. Can I? Yeah, that's interesting also. But what also happened in Indonesia during the COVID, our government implement the digital service. It's even for the debt registration, by the time of 2023, the debt happened during the COVID reached more than 90% completeness, while that happened in other years only stay in 50%. It enabled because of the digitalization of the service.
Thank you. Any other questions? The role of digital technology, I think, is crucial, no? In also servicing the under-reserved areas which are remote. I mean, maybe there are low-hanging fruits with newer technologies which are not too technologically demanding. These could be enrolled and used in those areas. One idea that came to my mind when you were showing, especially this picture with the rural-urban gap closing, we even in our work, we are unfortunately overseeing this. There are also differences within urban areas. And with SUSENAS, it's actually possible to identify with some methodology the slums, for instance. So it could be maybe interesting to see if there's a differential within urban areas, because it's difficult in surveys to peri-urban. There are more definitions. Our colleagues in EDD on urbanization, they know this better, but we also try to add some nuance to urban areas, because slums are only measured in urban areas. So we could kind of like divide urban households into slums versus non-slums to see if, there's something like that. But great presentation. And the final talk was great. Also, I think the importance of bringing quantitative and qualitative methodologies, because there are limits to the quantitative methods to identify. Thank you very much for your presentation. I don't see any other questions, and also I don't hear anything online. So let's go to Ms. Fausta and move to let's visit Tanzania and see how birth registration is doing there. The floor is yours, ma'am.
Thank you, moderator. Good morning. As I have been introduced, let me go direct to my presentation. First of all, I would like to thank UNECA. The success of this study started with the capacity building training, which was conducted by UNECA with the support of Bloomberg. And then we had a continued support from our supervisor, Lilian Siziba. She's here. I really appreciate. I also want to thank Vital Strategies, ESCAP, my co-author, Helen. I think she is with us online. But also I would like to thank my government, specifically my office, for allowing me to participate in this forum. So to start with, as we know that civil registration is vital, as it is emphasized in the 2030 agenda. In the United Republic of Tanzania, the under registration takes its history back to the colonial era, because during the colonial era, the laws excluded the registration of the native Africans. And it continued that way even after independence, because the law wasn't changed immediately. Until in 1985, where the civil registration program was established, and this was one of the initiative to improve the registration of vital events. Under this program, they start issuing the birth notification at the health facilities. And in turn, this notification has to be sent to the district registrar office for certification. And in the year 2002, it is where the laws were changed and make the birth registration compulsory for all. And in 2013, it is where the decentralization starts, where now the registration and certification were done at the health facilities. And for the community births, the registration was done at the ward offices. And it was at this time where they introduced also the mobile technology. But despite these reforms, still the birth certification was low. According to the 2022 Population and Housing Census results, 46.8% of the children under 5 years had birth certificate. So you can see that more than half of the children had no birth certificates. And these children are left behind, and they are at risk of being excluded from education, healthcare, and legal protection. So the aim of this study now was to examine the determinants of birth registration for the children under 5. The study design was cross-section, where we used the secondary data from the Tanzania 2022 Population and Housing Census. This is a recent census conducted in Tanzania, and we targeted the children under 5. The dependent variable is birth certification, whether the child had birth certificate or not. And for the independent variables included were the age and sex of the child, parental survival, age, education, education level, literacy and employment status of the head of the household, but also the location of the household. And the statistical analysis was done by using the descriptive statistic, but also we had the logistic regression model was built to predict the likelihood of birth certification as determined by the child characteristic and circumstances. The analysis was done using the R software. So from this analysis, the results show that the significant factors are survival of parents, place of residence, rural, urban, and the regions, but also age, education level, and literacy rate of the head of the household. And this was done within the 5% level of significance. So let me explain these results using the forest plot. As we can see from this plot, starting with the age of the child, you can see that the older children with age 3 and 4 are more likely to be registered compared to the children of lower ages. And when you look on the survival parents, the father and the mother, it seems that for the children whose parents are not alive, they are not are less likely to be registered. But the sex of the household head doesn't show any effect. But also living in urban areas, children in those households living in urban areas are more likely to be registered. But also as we go to the age of the head of household, it seems that the head of younger ages and the older one, the children within the household are less likely to be registered when you compare with the head of middle ages. And for education, you can see that for the head of household who have higher level of education, the university level or training after secondary, the children within their households are more likely to be registered than those with a lower level of education. And for those who are not literate, the children within their household are less likely to be registered. And when you go to the employment status, it seems there is no effect on birth certification. But also if we check the regions, in our country we had 31 regions. Some of the regions children are less likely to be registered, like the region of Kigoma, Katavi, and Rukwa. So as I mentioned before, despite the effort, still the gap is there. As we have seen that the survival of father or mother is positively associated with birth certification, but also living in urban area. And also for the head of household with middle ages. Also, as we have seen that the higher the level of education of the head of the household and being literate, the more the chances the children are registered. So from these findings, it's confirmed that birth registration inequality in Tanzania is affected by many factors. And this study had just highlighted the possible determinants of birth registration. So to achieve the SDG 16.9 by 2030, which aims at universal registration, the government needed to continue reinforcing equitable, inclusive, and sustainable registration system across all regions, ensuring that no child is left without a legal identity. So from these results, we recommend the government to scale up awareness campaign, especially in rural areas, targeting the low-performing regions, but also supporting orphaned children by designing inclusive policies, also monitoring and evaluating regularly to assess the regional performance, but also to use the sensors and survey data to monitor inequalities and to evaluate performance of birth registration. We recommend also for further studies, especially to examine how registration status affect the access to education, health care, and the children protection services, but also to investigate the registration barriers among special groups. I thank you all.
Thank you very much, Fausta, for this for your presentation. It was really illuminating. I think sometimes, personally, definitely me, I take things for granted. The survival of parents, I would have not thought, but yeah, the context matters, and we are seeing that it has a dividing power, explaining the variation, yeah, between those who are registered and who are not. And it would be interesting to compare the results maybe with the first study that used DHS, while yours was a different data, more maybe larger even. The population and housing census, they might be from the same years. And to capture also the intersectionality, you know, how the interaction of several of these drivers, if they can explain more also the variation. But thank you very much for sharing the results with us. And I would like to turn to our audience, online and in person, if there are any questions to Fausta on the results shared from Tanzania. Please.
Kind of picking up on what you were saying earlier, and comparing to Mosidi's first study, wealth was one of the strongest predictors in, I think it was 27 of the countries that you looked at. But then in your study, Fausta, you didn't find that employment was significantly associated with registration. So I don't know if you have the answer as to why that may be, or maybe the answer is more research is needed on it. But do you have any ideas why that association wasn't seen? And also, I noticed that education was associated with registration. So education and wealth are often associated with each other as well as employment. So that's my question. Thanks.
Yeah, thank you. From the study, it showed that the employment status has no effect. Maybe we need more study to check on it because whether the person is employed or not shows no significant, no association with base registration. I think more studies are needed.
Any other questions? I can also raise one, maybe just in connection. Also, DHS and Mix usually has the wealth indicator index available. In PHC, for example, can you do a composite index based on the assets of the household? Because there is the different nuance differences, right? With employment, it relates maybe a little bit more to flow, to income, while wealth is more about the assets. And, you know, they could have different mechanisms in influencing the dependent variable. Sometimes when we use household income expenditure surveys or census data, we try to recreate a wealth index to see, you know, if that would. I wonder if you, if it is in the data, if such variables are available.
Yeah, the variables to calculate the wealth index in census are available. It is possible to do it. So maybe we can do it to check how also the wealth index can affect. Yeah.
Thank you. Thank you very much. If there are no questions here or online, let's then go back to Indonesia, and we hear from Istiana about the paper. Yeah, floor is yours.
Okay, thank you, Dr. Selsa. Hello, everybody. It's nice to be here. My name is Estiana from BPS Statistik Indonesia. Today, I'm going to present about my research that is a Leave No One Behind analysis on birth registration among children under 5 in Indonesia 2024. Yeah, same as the previous presenters that already mentioned about the importance of the birth registration. So, but birth registration is more than just a legal record. It is the foundation of a child's identity and right. Without it, children may be excluded from essential services like education, healthcare, and social protection, and they can face a greater risk of exploitation and even statelessness. At the same time, incomplete registration also affect governments as it creates gaps in population data and weakens evidence-based policymaking. In Indonesia context, the situation shows both progress and challenges. Around 85% of children under 5 already have birth certificate. However, only about 57% are registered on time. And there are still wide regional disparities, especially in the eastern area, where coverage remains much lower. And from the previous studies from Indonesia, from my college, we have the nice finding about the factors that affected the birth registration. But is it enough to um, construct a policy in Indonesia? And I think we already have what factor that affected, but it will be nicer if we have or we identify who is need to be more attention. So given this, it becomes essential to identify the groups with the lowest and highest access to birth registration services in Indonesia and across regions. This is key to designing a more targeted, evidence-based, and equity-focused intervention. This study used secondary data from 2024 National Socioeconomic Survey or SUSENAS, focusing on children aged 0 to 4 years. And to analyze this, I use the LNOB methodology with card analysis 2, the classification and regression tree. And this approach helps identify which groups of children are the most left behind by breaking them into smaller groups based on their characteristics. In this study, birth certificate ownership is used as a proxy for birth registration, and the analysis considers both demographic and socioeconomic factors. Based on the 2024 census data, this figure shows that birth registration in Indonesia is relatively high, about 85%, but not evenly distributed. In Western province tend to have a much higher coverage, while Eastern regions are still lagging behind. For example, Yogyakarta has the highest rate of birth registration, around 98%, whereas Papua Pegunungan is the lowest at only 17%. This highlight the main challenge is inequality across regions, not just overall coverage. Um, Sorry, I haven't made this picture more presentable yet, but we can see the point. The first analysis result is the baseline decision tree of birth registration in Indonesia based on 4 factors such as child's age, sex, household poverty status, and place of residence. The most important factor is the child's age, which appears at the first split. Registration is much lower among children under 1 year compared to those age 1 year and above. Among children under 1 year, place of residence further differentiate outcomes. Children living in rural area have the lowest registration at 61%, making them the farthest behind group, while sex and poverty status do not play a significant role in this stage. For children aged 1 year and above, disparities are shaped by age, poverty status, and place of residence. The highest coverage at 95% is
found among children aged 2 years and above from non-poor households and living in urban areas, representing the farthest ahead group. Next is the decision tree based on the mother-related characteristics, including age, education, marital status, legal identity, and media exposure. The most influential factor is the media exposure, which appears at the first split. Children whose mothers are exposed to media have higher registration rate compared to those without exposure. Among children whose mothers lack media exposure, maternal education becomes the key differentiator. Those with low education have the lowest registration rate at 70%, making them the farthest behind group, while other factors do not play a significant role. For children whose mothers are exposed to media, higher education and older maternal age are associated with better outcomes. The farthest ahead group includes children whose mothers are aged 30 and above and have tertiary education, with registration reaching 93%. Yeah, if look at it in more detail at the regional level, across all regions, child's age consistently emerge as the main determinant, with children under 1 year having the lowest registration level. And the farthest behind group is consistently children under 1 year. In some regions, this group is not further differentiated like in Jawa and Bali and Sulawesi, while in others it includes children under 1 year in rural areas like Sumatra and Kalimantan, or female children under 1 year in eastern Indonesia. This is give more detail from Winida's previous study that sex does not significantly affect the birth registration in Indonesia nationally, but I found that in Eastern Indonesia, the female children, especially under 1 year, is more likely to be less registered in birth registration. For the farthest ahead, the pattern is driven by older age, better economic status, and urban residents, often including children aged 4 years in non-poor urban households. In terms of outcomes, Eastern Indonesia record the lowest coverage among the farthest behind at 39%, while Jawa Bali has the highest at 73%. Coverage among farthest ahead exceeds 90% in all regions, with the widest gap observed in Eastern Indonesia reaching 54 percentage points. And then, based on mother-related characteristic in most regions, maternal education emerged as the main determinant, while in Eastern Indonesia, media exposure becomes the primary factor. At the next level, the splits are mainly driven by media exposure and mother's age. The farthest behind group are consistently characterized by low education, limited media exposure, and younger maternal age, although specific combination vary across regions. For the farthest ahead, higher maternal education is the key driver in all regions, often reinforced by older maternal age and media exposure, particularly in Jawa, Bali, and Eastern Indonesia. In terms of outcomes, Eastern Indonesia record the lowest coverage among the farthest behind at 41%, while Kalimantan shows the highest at 79%. Coverage among the farthest ahead exceed 90% in most regions, except in Eastern Indonesia at 86%, with the largest gap again found in Eastern Indonesia at 45 percentage points. The key challenge lies in timeliness of registration rather than ownership. that we can see the lowest rate are observed among children under 1 year old, as registration often occurs only when families need access to other services such as school enrollment or social assistance. The most disadvantaged group are children under 1 year living in rural areas and those whose mothers have limited media exposure and low level of education. These groups face barriers related to access, limited administration knowledge, and lack of information. In eastern Indonesia, inequality is more pronounced due to geographic complexity and limited public service infrastructure. To address these issues, policy need to be more targeted toward vulnerable group and regions. Improving service accessibility through mobile registration and outreach is essential. In addition, awareness effort should be strengthened with a focus on these groups through community engagement and local media. For the next step, we need to acknowledge the limitation of this study. To gain more complete picture, future research should combine quantitative and qualitative approach. This will help us capture both the numbers and the life experience behind them. At the same time, since timeliness is the core issue, it's important to go deeper into understanding the specific barriers that delay registration. Exploring timeliness focused determinant will allow us to identify where the bottlenecks are and how they can be addressed more effectively. And finally, my research has reached this point not without the support of various parties. I would like to express my sincere appreciation to Indonesia CRVS team, Kak Winida, Kak Vina, and Raja for their support and for enabling my participation in CARD program. I'm also grateful to UNECA, UNSCAP, and the CHART team, Petra, B, and John, my mentor, for their continuous guidance through this research. And special thanks to also to Dr. Selsa for his valuable feedback and technical support during the data analysis. And that's the end of my presentation. Thank you for your attention.
Thank you. Thank you very much, Estiana. I think Vinida, Estiana, you guys should go together to conferences. It's perfect package on Indonesia, yeah? Starting overtime and national, and then disaggregating more and using different methodologies. It was great to hear, and we learned a lot, definitely, about Indonesia, which might inspire other countries to follow similar quantitative approaches. I think I have some further suggestions, but one thing to say that I noticed the graphs, and I promise that we can give you the nicer SCAP LNOB visualizations. You know, you share with us the inputs, and we'll make those charts. Any questions from the floor on Indonesia? Oh, okay, we have nice questions. Okay, maybe yes, Liliana, yeah.
Okay, thank you for the platform. Thank you, Estiana, for the wonderful presentation. Mine is just a question seeking understanding of the linkage. In your presentation, in your paper, you referenced birth registration, certification, possession of a birth certificate, and the data coming from a survey. So my question is around the linkages, right? So I would want to find out how in the survey, right, confirm it's a survey-based analysis, how the question was asked, and then in the processes of the business, I can say the processing of a birth certificate, how the two processes, birth certification is linked to or transitions or is related to registration. Registration, are they one and the same thing? Is it given that if someone has registered. I can analyze registration from possession of a birth certificate. So kind of like the definition of the variable that was used as your outcome variable. That's my question. Thank you. By the way, I'm Lillian Siziva from Zimbabwe. I support ECA on various CRVS research initiatives. Thank you.
Yeah. Thank you, Lilian, for the question. I use birth certificate ownership of under proxy of the birth registration from Susanna's data. So to gain the variables, it's use a question from the survey that is, do you have a birth certificate from the civil registry office? May I see it? And the response is categorized for the one category 1 is yes, can be shown. 2, yes, cannot be shown. 3, do not have, and 4, do not know. For my research, the response coded as 1 and 2 will be classified as yes in my variable, and the response coded as 3 will be classified as no. And the record that say they don't know birth certificate or not, I remove or exclude from my dataset.
That's okay. Thank you.
Thank you.
Thank you for that. For the next question, let's maybe move like this to this side. We have another colleague in the table. Please.
Estiana, that was good. I will not ask you a question because we're in the same group. Actually, we were in the same smaller group back there, and I know you still have a lot left to do. I just wanted to give you a word of encouragement. This thing of under 1, not just under 1, under 5, even from a census, we normally have a problem of, let me call it undercounting. You'll find a mother holding, let's say, a 1 month old child. And when you're doing a census and you ask her, how many usual members live here? She says, I'm alone. It's like this baby is not a human yet. Yeah, so it starts from there and you can see the spillover effect. So I'm looking forward to see your results. I know you're not yet done. Yeah, thank you.
Yeah, thank you, Jim, for the encouragement.
Thank you. Thank you very much. Next question, yes, please.
All right. Thank you very much for the opportunity, and that's such a great presentation. By the way, my name is Basil Tongbane. I'm a Ghanaian statistician and demographer. I was part of the CAC1 cohort. That's the first cohort on this particular training. So my question is, I'm very much interested because I saw that though even the eastern part of Indonesia, the registration was not as compared to the western part, but indeed in general is high. So I want to find out what is the registration approach in Indonesia. Is it an active kind of approach or passive? What I mean is it maybe when the birth occurs, is it something that automatically the health institutions are mandated to record and ensure the registration, or it's dependent on the parents of the birth to ensure that the registration is done? That's the first part of it. Now, my last question is, I was also thinking through the issue of timeliness that you raised. And I was thinking in the study, even though you used ownership as a proxy for registration, were there any questions asked on when that ownership card was gotten or obtained? Maybe perhaps you could also use that as a proxy to assess timeliness. Thank you.
Okay, thank you for your question. For the first question, the process of registration in Indonesia, it's actually the people have to come to the registry office to register whether their birth, death, marriage, and divorce. And in some regions or some districts, so actually there is a practice of outreach also, but it's not it's not implemented in it's not implemented yet in all regions in Indonesia. So it's still it still have a limited coverage for the outreach. And in Indonesia, the regulation related to birth registration is it's mandatory to register the birth within statutory period 60 days after the birth. But if people don't register their child's birth after that period of time, there is no punishment. So it's depend on the awareness or the participation from the people to register birth in Indonesia. So in my recommendation, I mentioned that digital registration and outreach is need to be more implemented, especially in Eastern Indonesia, as we know that the coverage there is still low. To increase the registration there. And for the second question, yeah, for the survey, Susanas, there is just one question related to birth registration. That is, are you have the certificate or not? And we don't ask them where the certificate issued. So we cannot have the information about timeliness from the survey. Actually, we can gain that information from the registration data, but it's not in our ownership. It's belong to the Ministry of Home Affairs, and the regulation state that sorry, except them, we cannot use the microdata freely. So that is also my limitation in my research, that the birth certificate ownership cannot represent the timeliness. Thank you.
Thank you very much. We have one more question, Petra, please.
Thanks for making the time. So I think I'm having a bit of difficulty with how you're treating the age of the child, because even if, let's say, everything is equal, we expect registration to increase with age, right? You can't be unregistered. So as a child gets older, that we know that they're more likely, to have their birth registered. So when you say like that children under one are more disadvantaged, but if you look at it with a cohort approach, well, they're not more disadvantaged. They will eventually have their births registered. It's just, it's not happening right now. And I just wonder if that introduces maybe some indigeneity into your model that needs to be taken into account. So I just thinking we might need to look at how you're treating the age of the child, because I don't think we can treat it in the same way as the other explanatory variables, just because it's also, I think, also, it's also a dependent variable as well. So I'm just a bit worried about phrasing it as saying that children are more disadvantaged if they're under one, when actually eventually that they will have their births registered. So we might maybe just divide out eventual registration and timeliness of registration, perhaps, or maybe we just need to think about a different approach. But I will say, I saw your work earlier on in Nairobi, so it's really great to see how it's developed. So well done. But just a small point on that.
If related, William, do you want to come in also? We can bundle the questions maybe.
Yeah, definitely I can help on that. I mean, the simplest way to do it is to identify for the children, are they censored or not censored? Because the ones who are censored, they still have an opportunity to register. So you can just, enter that variable and say, for these 1-year-olds, are they still censored or not? Then, so that you don't go to event history analysis, duration, and whatever. I think that will be the simplest way to look at it. Because these children, they are not yet late registered because they still have an opportunity. And you can identify them. You can actually identify. So let's say for Zimbabwe, we would say, if the child is still under 42 days, I think our registration is 42 days for birth. So you can identify those by their age and just enter it as one of the explanatory or control for it. You actually control for it. Okay.
Thank you, William. Christian, I can later come in also. But please.
Yeah, thank you, Petra. I'm William. Yeah, in my research, the finding is that the children under 1 year is tend to more less likely to be registered. So I concluded that the registration is or that fine implied that the registration is still delayed in Indonesia, because if we refer to the statutory period in Indonesia, that is the 60 days. So we can say that 1 year is also a long time delayed from the statutory period. This, thank you.
Any other questions on this? If not, maybe in the interest of brainstorming, there are alternative ways that one can also look at it. For instance, you can have a model where age is not there to see what happens. The other is that you run the card for 1-year-olds, 2-year-olds, 3-year-olds, 4-year-olds separately, because among the 1-year-olds, there are some who are registered, right? They're not zero. So I think in many cases, they're like 50, 60% that are registered. So there's still decent variation to explain. So that age-specific analysis could maybe help, because in the beginning, you're finding that under 1 is the priority. So, okay, let's zoom into the under 1 only and see what's happening, what explains who's registered and who's we on our side, we had also lots of debates about this. Should child age be a part of the model or not? And this brings me to overall, I think, a common thread in all the 4 presenters earlier. It's not easy to establish your disaggregation model or your regression model, like to justify why there's a variable in the model and why not. And with machine learning, there are even more rigorous methodologies where you can plug in there 20, 30 variables, and then with conditional inference and random forest, you can actually, the model could tell you which independent variables should be included in the model and which shouldn't. And that is your first step. And once you fix those, then you go into the second step of running the algorithm with those that are coming out as the most relevant, because that's also like essentially finding the interactions between those circumstances taken into account. But I mean, food for thought. This is ongoing research, right? So we can definitely continue working on this. Thank you very much for your patience, Rogers, and being here on this head table with me, not leaving me behind as the only male. Let's go to take us to Zimbabwe and show us, please, how the results look like in birth registration completeness under 5-year-olds. Thank you.
Can you run the?
Yes.
Oh, thank you. We're using the moderator's mic. And morning, ladies and gentlemen. My name is Munashati Rogers Sango. I co-authored this paper with Rachel Tsaurai, who is not here. Probably she is online. And I would like to start by acknowledging, I would have wanted to acknowledge Rachel first from what is already on the presentation. But let me also acknowledge the team, the presentation team. I have learned a lot from them today. So from there, I go on to acknowledge my co-presenter, my co-author, Rachel. I have mentors, Dr. Mosidi and Dr. Sisiwa, who are here with us. I'm proud to present before them. I also want to acknowledge my institution, Zimbabwe National Statistics Institute, for allowing me to use the census data, and the international collaborators and funding partners, UNECA, and vital strategies for support, financial and technical resources. Our families for the support. Right. Birth registration. If I can give a background of this research, it starts from the census data. We were getting very few. We use administrative data from civil registry to produce the vital statistics report. But we took quite a long time before publishing any of the reports because it had very little number of records. Civil registration did not have enough. And from the statistics side, we couldn't claim for more. Say you gave us 20,000 records, we were expecting 100,000. So we had no basis of argument. That's why we then had to fit in the vital statistics questions in our population census data so that we get the denominator, which we could then use to advocate for more records from civil registry to say we are expecting so much, but we are giving us less. That's when we included these questions in the population census questionnaire. So this is a hidden crisis in the country. First and foremost, Zimbabwe has got laws. If you look at the legislation in Zimbabwe, you wouldn't think anybody is left behind. I mean, the laws are perfect. You'd think the civil registry's hands are open to register anyone and everyone, but that's not the case when you look at the population census data. Without the population census data, you couldn't claim anyone is unregistered. There would be no basis of argument. So we now go back to the presentation. It's a foundation. Birth registry is a foundation of legal identity. But you look at 38% only in Zimbabwe of under fives which were registered. And these were excluded, obviously, from healthcare, education, and protection. All right. This is how we investigated. It was a descriptive cross-sectional study using the population census, if I had alluded to. The variables being the child's age, sex, household heads, education, religion, the household's access to television, phone, and internet. And the analysis was univariate, chi-square, logistic regression using R software. The purpose was to identify demographic, socio-economic, and institutional drivers of inequality. This is what we found out. 21%, we found out that registration increases with age. If the child is not registered at 0 age, you might find them registering after 1 year, after 2 years. And we are now saying infants, 21% of infants were registered. That's at 0 age. And it increased up to 56% at age 4 because we are looking at under 5s. And on our analysis, we found out that no gender disparity, boys and girls were equally affected. And using education and religion, you find that certain religious institutions would register their children than others. And education, the higher the education, the higher the registration of the births of their children. But when we looked at tertiary education, probably because they will be lower, you find that the numbers of children in those households which were registered were also lower. But when we go to possession of assets like televisions and phone, among others, those who had these assets had higher registration. But overall, 38% of under fives were registered. This means inequalities were shaped by social, cultural, and infrastructural barriers. And the education, as I have talked about, religious affiliation and digital divide are also critical determinants. Global implications, they are similar in other low and medium income countries. Solutions can be transferable across regions. Well, now I'm saying, while findings are rooted in Zimbabwe's experience, these challenges echo across many low and medium countries. And the next slide highlights shared barriers and solutions that are not only effective, but transferable across regions. Right, we are looking at low registration coverage, fragmented systems in our country, limited public awareness, underfunded infrastructure. And when we are looking at examples of transferable solutions, you look at mobile registration units. Well, in the country, Zimbabwe, we sometimes implement mobile registration units, but they are not informed. They are not targeted to where it's needed. You find that if you are dispatching mobile vehicles, they will dispatch mobile vehicles to every district equally, without specifically saying this district has lower registration rates. Let's allocate more resources there. If it's number of days, if it's the personnel and more vehicles, that was not being done. They would dispatch equally, because that's civil registry doing that. It wouldn't be using empirical evidence to allocate the resources during mobile registration. But we are now saying this time around, after the census data, we have now shown them the pockets that need more attention, and probably this one is going to be, this time around, they are going to be more objective using the empirical evidence. The integrated digital systems, you find that the civil registry has got its own database, Ministry of Health has got their own database, and they are not linked. We would expect them to link to each other so that a birth that occurs in the institutions can actually be transferred immediately to the database owned by civil registry. This is not happening in the country, and this might be causing problems. And policies. You find that recently in the country, there's a statutory instrument that was done, was it in 2023, which empowers traditional leaders to issue birth notifications and death notifications, which under normal circumstances or in the past were used to be issued by health institutions only. We are now saying those out of those community births can now get the birth notification form, birth notification record from the traditional leaders. But that's just a policy, and I'm glad it's not easy to come up with a statutory instrument. While that has been put in place, I have not yet seen the fruits, but it's there. So that's policy reforms. Then cross-sector partnerships. Cross-sector partnerships is something else we need to be linking with other institutions. But maybe when you're talking about Zimbabwe, the ID is linked to the birth certificate. that one is there and is functioning properly. So it can also be done in other regions. Then what must change? Outreach in rural areas, as I have talked about, in marginalized areas, should be done using empirical evidence, linking the health and CRVS infrastructure expansion to those areas that need it. Digital platforms for awareness, religion, community, talking to them so that they would bring in their children for registration and simplify the processes of registration. Also monitoring and research. You find that civil registry in our country and in other countries does not care much about the statistics side. They are worried about issuing the records. So they have no empirical evidence or they have no statistics to monitor their work besides generally knowing how they are behaving. They keep to themselves. We need to monitor through research the processes that are affecting civil birth registration. And research gaps, we expect probably in future to come up with studies, qualitative studies on cultural and religious barriers, longitudinal tracking of late registration impacts, pilot mobile or digital registration programs. Because initially that was the plan when we decided that let us empower the traditional leaders. And we had proposed that we give them mobile devices to send the information directly to civil registry, but civil registry decided to make them use paper. So we are advocating for piloting digital or mobile gadgets for registration programs. Then across country benchmarking for transferable solution and policy evaluation and capacity building. Thank you.
Thank you. Thank you to you, Rogers, for your presentation and showing us the results from Zimbabwe, but also extensively discussing the next steps, policy recommendations, and hopefully the transfer of knowledge from other countries. Do we have any question on Zimbabwe? There's one question here, please.
Yeah, thank you. A very nice, insightful presentation from Mr. Rogers from Zimbabwe. I'm just curious about the religion factors because in Indonesia we don't collect about information about religion, especially in Susanas. I'm just curious why religion in Zimbabwe significantly influence the birth certificate ownership in Zimbabwe. Maybe you can just tell us about that. Thank you.
Thank you for the question. We are wondering why. But what we did, these are results coming from the census data. And we are saying we would now want to investigate further. We were asking, what is your religion during the census? And on analysis, we noticed that there are certain religions whose children's births are not registered. So that's an area of investigation. We have them, we know them, but I don't think this is the correct platform to put their names across. But we are saying, we are also questioning that, so that it's an area of investigation. Thank you.
Thank you for this. Religion is a always very sensitive issue, and in LNOB algo platform, we at times put this on, but interpretation becomes also tricky because people could make sweeping, let's say, statements on, trying to move beyond some descriptive results to causal. Maybe there's nothing causal really that's at least captured in these methodologies that we reviewed. But thank you for. I was about to ask which groups are there, but you nicely said don't even ask. No problem.
They are there in our report.
Okay, okay.
We have published. We have actually published a thematic report on vital statistics from the census. So it's available on our website.
And it could be, I think we've seen this in some Pacific islands where the entire island is, for example, Christian, but there are different sects of Christianity, and you'll see these differences even within the broadly same religion, the different sects having different access rates, and it's probably not the religion or the sect identity itself, but it's something else that's just driving those results, right? So that's where I think the careful interpretation is needed. One quick question, maybe in the report you have more info on the sub-regional or district level estimates, because you're using the census. So you could say something about Harare versus, I don't know, Victoria Falls. Those are the two district cities that I know from Zimbabwe.
Thank you very much. That's true. We actually used urban rural, because if you are talking about Harare, that's purely it's an urban province, and we've got two major urban provinces, Harare and Bulawayo. They are high registration, and now so in the report, even in my presentation, we are looking at urban and rural divide rather than, of course, if you go in the other 8 provinces are rural provinces. So they are more affected than Harare and Bulawayo. So we just decided to treat them as urban rural. So even if you get in the rural provinces, we also have their urban centers. The provincial capital is an urban center. They also have higher registration rates than the purely rural rates. Yeah. So while for advocacy purposes, we actually have 2 census reports. The other one is just there's no description, there's no text. We are just presenting the results of the census from the highest level to up to the ward. We have province, district, then ward. We have a ward councillor. We are telling the ward councillor that you have so many people without an ID, so many people who are not registered, who don't have birth certificates, so that we expect them to advocate for the registration. And when we go to district level, we have the same. The district development coordinator, we present these results to say you have got so many people in your district who don't have birth certificates, and we actually indicate where they are. So that for advocacy purposes, they can actually target resources to those areas for people for registration, and the same as at provincial level. So we have got 2 reports. The first edition, which describes everything about vital statistics, including marriages and divorce. But when we developed another one, which does not have figures. If you are a ward councillor, you go to your page, you look at how you are performing as a ward. That's what we have. Thank you.
Thank you. Thank you very much. And with that, we completed the 5 presentations and the Q&As that followed it. So we have, I think, close to 25 minutes. If you would like to have a further questions, answers, or sharing comments or sharing insights from your own country, we have time to ask questions to different speakers or broadly to all of them. For the first one, I saw a hand already, so I'm going to recognize you. Maybe introduce yourself first, and then if you have a particular question to a panel member or broadly, we listen to you. Thank you.
Thank you. My name is Mose Job from East African Community Secretariat. I have a question and observation. My question is to Mosidi. I saw that he made an analysis of from multiple countries, around 37 countries, from various sources, DHS and the mix. And I know that DHS is normally done in a series, different series. And there was a change specifically on the module and birth registration from 5th, 6th, 7th, and 8th series.
Now I was wondering whether the data used from across those countries is from the DHS 8 series or 7, and if it is from different series, then is there maybe an effect in terms of the time difference and the change in the methodology? Because the indicator you generated is like one indicator across the various data sets. So maybe you could comment on the effect of the time difference, the DHS, the surveys were done, and maybe the methodology, the difference of methodology between the DHS and the mix, maybe if it has an effect in terms of your data processing. Then the other one is on the other various presenters who focused on the inequality and the issues to along the leaving no one behind. I didn't see when we talk about leaving no one behind or these inequalities, we sometimes also bring in the issue of the special population groups. I don't know whether we're able to look at like the children born out of the parents who are PWDs. Is there an effect in terms of leaving no one behind? Those born out of parents, the homeless parents, the minority groups, refugees, and all that, whether there was some difference in terms of the inequalities. And now maybe for those who are still working on their papers, is it viable for you to bring in that concept also? Like if you look at Indonesia, there's islands. How does the inequalities, are there inequalities between the island, the migrants, and all that? Then the issue of religion, I know Zimbabwe brought it out. And I also know that even in the censuses, there are some, when you observe censuses in various countries, some religious groups will tend to decline or refuse to be counted. And even for registration, religion will play a very key role. And therefore, when you are looking at the special groups, you may also think of segregating by religion as done by Zimbabwe. Though I know religion is also very sensitive, depending on where you come from, but it is something that has an impact in terms of the registration and all that. Even the parenthood, there are those children born out of the single parents. And so how does it, that variation it also needs to be brought out if possible. Thank you.
Thank you very much. Let's maybe start with Mosidi with you, and then we can open it to other panel members if they have reflections on how they can.
Okay, no, thank you. Thank you for the question. Yeah, I think it is one of the issues we flag as a limitation, because the surveys were not undertaken. There are some countries where, for instance, we had the latest survey maybe in 2018, and then you had a country where there was just one survey maybe in 2016. So I think it is acknowledged in the paper that there is that issue. Then there are countries where you had two surveys, so you could actually look at 2 points. I think we do talk about that. Remember, our key variable in the study was whether or not a birth was registered, and there was consistency in terms of how it was asked in the two surveys, in terms of what we can use. But other variables, for instance, were not consistent across. So we do note, for instance, the issue of ethnicity, as much as in some African countries, it's one of the things that we know it's quite important. We couldn't look at it. We couldn't look at languages as much as we would have loved to, because then there were some countries where it was not asked, consistently across the two um, um, surveys. And Lillian maybe can remind me, there were other decisions that we had to, other variables we had to drop, because when you look at how the two surveys treat them, we ended up not using them. So there were those limitations, I think.
There were questions about the different, yeah. Fausto, would you like to go ahead?
Yeah, thank you, Mose, for your observation. For the case of these special groups, for instance, in our paper, we recommended it as a next step. We can do specifically to check how these inequalities affect the special groups. But also for the religion issue for our country, in our country, we didn't collect the information on religious. Thank you.
Others, would you like to talk about like your plan? Yeah, go ahead. Please.
So thank you for your observation as well. Yeah, I think that's really important that you post some limitation for our research regarding there is no specific analysis regarding specific group indigenous. Yeah, there is a limitation also because we use the survey that is the methodology only targeting the usual household. So there's no information, there's no data regarding for the group of indigenous or my refugee, homeless people. They are excluded from the sample, so that we don't have further analysis on that. But that's really important. But even though we are working only on this recognized group in the survey, there are still lack in some group in terms of region, in terms of the mother and household characteristics. But I think that's really important to also as a further research for in Indonesia.
Thank you. Istiana, would you like to come in for if you have any? No, okay. For you, any suggestions?
I'm looking. I've talked about religion. Those born out of wedlock, our laws allow a mother to register the birth of their child in her own name. The law is open. It allows that. And as for refugees, most of the refugees in Zimbabwe are in refugee camps. And the Civil Registry Department, time and again, goes into the registration, into the camps to register the births. So that's why I then said, the question was now, those who do not register, what are their characteristics? What's their background? Because if you look at the laws of the country, they are open. Anybody can register. Even you can even get an ID, but it's got some variables which indicate that you are not a Zimbabwean citizen, but you are documented. So that was the cause for this investigation. Thank you.
Thank you very much. Any other questions? While we wait, maybe one idea that came to me regarding your questions, the disability status. You mentioned the PWDs. It's about the parents. It could be any other person in the household, and it could be the child himself, herself, right? They could be a determinant. And I think Indonesia collects this information, but apparently it's not publicly available. So we'll see ways in which we can maybe access it later so that they could be included in the model. Maybe if there's anyone in the household or if a parent. I think Mix has detailed questions about the functional difficulties of the adults, but also of the children. So those who are using Mix could, I think, refer to that. Migration status, most surveys will have something about the internal migrants, or maybe if they're receiving any remittances from their household members who migrated, so they could be a proxy for international or domestic migrants. But this is a challenge we face also on our side in the LNOB work stream, that as Vinita mentioned, those who are not in the usual households, they're completely out of the picture in the analysis. Petra, I saw your hand. Would you like to come in?
Thank you. So this is actually just a bit of a methodological question. And Sal, you might also want to jump in because I know you might have thoughts on this. So those who use the CART analysis, and it's to build also on B's question, what do you think that this analysis on its own is sufficient? And just to understand a bit better, though, it's not inferential, right? And you could actually get some really, really tiny groups when you go down into these. You're drilling down into these, characteristics in these groups. They could be really, really small, maybe not significant. So just wondered if you had any thoughts on that, and if you think that maybe it's an interesting exploratory study, but to really get to the, I guess the recommendations, you might need to then follow up with something else. Do you think it stands on its own as it is? So that's, I guess, to those used. Sorry, Estiana, to go back to you again, but also I think with Sidi as well, and obviously Salsa, I know you work on this too.
Who would like to go first? I'll come last in the defense. Yeah, go ahead.
Thank you, Petra, for the consideration. Yeah, I think the card analysis is it can clearly divided population into the group that farthest behind and farthest ahead, and in terms of the consideration about the variable that might not be significant or not. I just thinking just now, what if we use the result from maybe Winida's result that what is the factors that significantly affected the birth registration, and we can further analyze it with the card. So we can we get the both what is the variable that affected and who are the group that left behind.
Thank you, Mosi.
Maybe I can say that I think that the issue with it is that as you do further disaggregation, then the numbers become too small, then you can't go beyond. Maybe it's the effect of the survey. But I think she's correct that maybe from what you have seen, you can do further analysis, I think. Yeah.
So I think we all agree that CART, the classification regression, this machine learning algorithm, is a descriptive tool. It's not inferential. So there's no T statistics, F statistics coming out of this. And the way we use currently ANOVA, we are deciding which variables will be in the model based on the literature review or the SDG metadata, what it calls for. So in that sense, it is descriptive. There are, though, guardrails about making sure that we don't go to too small groups, right? We can impose those parameter restrictions so that we don't overfit or we don't end up identifying a very small group that's just with the outliers. The advantage, so in that sense, I think it should be complemented with standard regression analysis, be it OLS or if they're the instruments, IV regressions, logistic, whichever type of regression model fits. But the advantage of the tool is that it's non-parametric. So parametric models have their advantages, but this is a non-parametric one, and the benefit of non-parametric is that you can capture these intersections far easily and more efficiently than in a regression framework analysis. So we see sometimes that you'll have a regression model with, let's say, 10 variables in there, independent variables, but while we're controlling for those 10, we're not looking into their interactions. And if we were to interact them, it would be we would lose so many degrees of freedom. So it could be that one could start with CART, see what's coming out, and then dig deeper in parametric world and testing for significance or looking if there is anything that's deriving this result. So there could be a little bit of a start with CART, which is also more appealing to policymakers because the visualizations are maybe a little bit easier than a regression table, easier to interpret, and have the results on a dashboard as opposed to in a paper. So there are those type of advantages. But I think if we want to go anywhere with causal, we'll need to use parametric models and essentially, I believe, try to find out these natural experiments and see, if we have a clear treatment control group that we can use then standard regression models to identify the impact, size, magnitude, and its significance in a way that we feel comfortable that we can have causal interpretation. So let's say it's really the tip of the iceberg to start with, but it's a beautiful iceberg and will hopefully not melt. We have still a few more minutes. If there are any questions, we are standing ready for lunch, I'm sure everyone, but if there are any other questions to any panelists or if you want to share an insight from your country, we still have some time. Anything from the virtual colleagues? Maybe nothing coming there. Okay. Maybe final words from the panel. We can ask if you would like to add anything before we close. This time I'll start from this side and then we go that way. Please.
Thank you. I think our biggest issue on CRVS is bringing the institutions together. The three institutions, civil registry is in between. We start off with the Ministry of Health, where births occur and where deaths occur. And then we come to civil registry, where they register these events. Then vital statistics at the far end. It's like it depends on what has happened in the health institutions and what has happened in the civil registry department. But if nothing comes up to the end, there's no statistics. So there is need to bring these three together and bind them so that they work together. Sometimes civil registry thinks we are poking our nose into their business, and they try to defend their area by giving you very little information and keeping the rest. So I think this is one area we need advocacy at regional level. We are trying it at national level, and we have gone this far. We are making progress in Zimbabwe. Thank you.
So thank you. I just want to highlight that regarding Indonesian case, we saw there is like increasing over the time, but it's not enough. So we move from coverage focus to timely registration, as we saw and also highlighted by Petra's question regarding age. Of course, the completeness of the children registration will improve over the age of the children. But this finding also highlights that early infants they are in the risk in the bigger risk of being excluded in the system. So we need to focus on the early timely registration. And also, we need to move from general solution to targeted intervention, because there are some groups that are still in the disadvantaged situation within the country and also over the world. And we need also to move towards the child-centered approach and not only system-centered. In that way, we need to review again the law and the regulation in the country to facilitate children to be able to be registered regarding their status of the parents, regarding the status of their migration status or their other status. Thank you.
Yeah, in the context of Indonesia, I think Winida is also already say it all. I just want to say that more we discuss about our result, more I realize that we still need a lot of things to do. It's just like Selsa explained before, we can join the methodology, and also our limitation in the research. We need to include the marginalized groups that we cannot reach easily, and I think for the next steps we can strengthen or focus more about the qualitative aspect, so we can see more clearly what the cause from our finding. Thank you.
Thank you, moderator. For my case, maybe I would like to emphasize on the need of evaluation. As one of the presenter mentioned, that without the census data, we cannot know what is happening. So for instance, as we used the 2022 population housing census to evaluate the rate of certification in our country, but there is a need to go on doing the evaluation to know how the situation is changing. So after maybe some time, we can use maybe survey data to do evaluation, and we can see if there is any effect for the efforts which is being done in our country. Thank you.
Okay, thank you once again. I think we would, on our side, like to acknowledge, I think, the comments from CELS about doing further research, maybe using alternative data sources. With the 2020 rounds, maybe it gives us an opportunity, rounds of censuses, to look at what is feasible. Well, maybe the challenge could be the questions themselves, whether or not they're there and how they are asked, but at least it's something we can look at. But also, I think to indicate that, one of the limitation, I think, of the study was the data sources themselves, the timing as well. And also, when we did literature review, we saw that a lot of work was done on the continent on registration. But it was general registration. It was not child specifically focused on the children. So hopefully that is a takeaway for countries from the study. Thanks.
One final burning thought from Zimbabwe.
Thank you, moderator. Talking about census data, thank you, Mosid. My proposal is that can't we more come up with standard questions, standard CRVS questions for those who will be putting in those questions into the census questionnaire. Can we come up with standard questions so that the data becomes comparable? It's like you were talking about this questionnaire does not have, or people ask it differently, and you cannot analyze across countries. So I'm proposing that it can be a regional proposal that we standardize. Whenever we think of putting the CRVS questions in the census questionnaire, we standardize the questions. That's my proposal, moderator. Thank you so much.
I think if you look at the latest version of the principle and recommendation, there is the standard is there. The latest version. Yeah.
Thank you. There's more work to be done, and I think your results are definitely pointing towards or giving direction to further analysis. I would like to thank our panelists very much for their research, for their work, for their presentations, using empirical methodologies, using national representative household surveys or administrative data to disaggregate this important outcome indicator and share their results with us. Thank you to all the participants for engaging and sharing your questions. And thank you to organizers for making the life of the moderator extremely easy and fun. With that, right on the clock, I would like to close the session and wish you all a great rest of the day. Bon appétit, and see you in the future. Thank you.